Hi, my name is Tony Cipoll. I'm the Chairman of Emergency Medicine at UAMS. I want to talk to you today about the Icare Conference, or the Icare Initiative, that has been put together by a consortium of individuals throughout the state of Arkansas. Icare stands for Improving Critical and Acute Care Through Regional Education. So why this initiative and why now? The American College of Emergency Physicians recently released their scorecard for emergency care throughout the United States, grading each state in the union. Unfortunately, Arkansas graded as a D-, which is the same as it graded out 5 years previously. The highlights of why we didn't perform so well are exactly what we plan to address or have addressed with the Icare initiative: access to care, quality of care, pre-hospital care, and healthcare delivery for emergency services in general. This past summer was the inaugural Icare event hosted in Rogers, Arkansas, and this wasn't your typical medical conference. We purposely wanted this to be a participatory event to develop a product that could be used to meet our mission, which is to improve healthcare throughout the state of Arkansas. So the event covered 3 days. The first day was completely hands-on with 3 very exciting pre-conference offerings: bedside ultrasound for rapid diagnosis and management of sick and ill patients, disaster management, and PPE, personal protective equipment, in case of a massive disaster. The ensuing 2 days were then comprised of workshops and very short interactive TED-style talks led by national experts as well as local experts throughout the state of Arkansas.
The uniqueness of Icare conference in the state of Arkansas was that it brought all professions together in one place, where the pre-hospital, emergency medicine, as well as critical care were all together in this conference to discuss how we can improve the quality of care that we provide to our patients at the bedside.
My experience was very beneficial, being involved in the simulation scenario, as well as in the skills lab and the panel discussion on sepsis. And it was a wonderful opportunity for nurses as well as the other professions to be involved together in all of those settings.
What's very exciting about this conference is that it's a very dynamic process, and that it provides a voice to participants. If you want to actually improve outcomes, you have to do it as a team. That is why we designed this conference to be interprofessional. And what I mean by interprofessional is when we all learn from, about, and with one another to improve better outcomes.
One of the exciting developments in the Icare conference was our ability to collaborate with local leadership. For example, Chief Tom Jenkins and Captain Lance Lawyer.
And it's an opportunity for nurses and doctors to get familiar with us, to get familiar with the equipment we use, and for us to interface a little bit more efficiently with the ER.
So we chose Northwest Arkansas because of its vibrant and growing population, as well as it being the hub of innovation for both industry, healthcare, and especially pre-hospital medicine. As a matter of fact, a number of large industry providers there are experts in disaster management, which is something that is very important to healthcare delivery for emergency services.
So the way we designed our final day of the conference was that we focused on what's called the triple aim. So our group and our planning team came up with an innovative model to use consensus methodology, whereby pre-hospital, physician, nursing, pharmacy, and critical care providers came together to focus on both the barriers and the drivers that most impact the patient care experience, the population health, and the cost of care. We use that consensus methodology to then come up with recommendations to improve the access and the care for the most vulnerable within our state. That's a methodology that we plan to use year after year so that we focus on the triple aim and we actually improve the outcomes in the state of Arkansas.
We also had representation from the state Surgeon General, as well as our state EMS director and Senator Hendren, because we feel it's very important that not only we in healthcare understand the needs and the gaps in emergency care throughout the state of Arkansas, but that those that can make legislative decisions are part of the process. The Icare conference this year was a resounding success. We have motivated, incredibly intelligent individuals that are working hard to help us define the curriculum, the need, the gaps, and the solutions to improve healthcare through the state of Arkansas. Moving forward, we fully expect this conference to grow in the near future and engender more ideas, discover more issues, but provide more solutions to continually improve the healthcare of Arkansans as well as those throughout the region.
A single profession may or may not had as loud of a voice as they wanted, or they didn't have an opportunity to meet with a team to discuss how we address these disparities. This conference allows that opportunity. Their voice will be magnified. We will improve the care of Arkansas through Icare.